Customization of protocols. In this webinar, I'm going to informally discuss how you go about changing protocols for different scenarios. So what I'd like to do is pull up the software and run you through the basic parameter changes and how you would go about changing frequency, duty cycle, and other parameters, giving you some basic case studies so that you can incorporate this with your patients. So what I'm going to do is drop down this title page, and we're going to pull up the software. So again, you're going to just double click on your software, load that up. Okay, so recall that typically you're going to add a patient name or go to the existing patient. So let's say we pull up an existing patient. Here's our patient here. We accept this patient, and now we have this patient in our system. Notice that the patient already has some protocols under A and no protocols under B or C. So a few things I should mention that for this specific patient, if I wanted to override a protocol, I can load a new protocol over top this previous patient's protocol. So for example, if I want to prescribe a treatment, I click on prescribe treatment. Let's say I want to go to head and neck, cervical spine, stage 1. And then if I click on accept, this box will show saying selecting a new treatment will cancel the treatment currently selected for this patient. Do you wish to proceed? If you click on OK, notice now that that new protocol is in its place and the previous protocol has been deleted. That protocol will still be there in the history. So if you go to the history, you'll see that that prescribed protocol was previously put in at a prior date. Okay, so let's just exit this and start from the beginning. Let's first understand the main procedure for why you'd want to customize a protocol. Recall that we talked a bit about patient factors, age, skin color, for example, and other factors we want to compensate. You can do that by clicking on the factors button. So for example, if we put in a new patient and put in their name, let's just say their surname is, say, Kurt, and then put in their first name, then put in the specific code for that patient, their birth date, and then you can go to factors. So recall that if this patient is, for example, Asian, then we would increase, if we clicked on that patient factor, you notice that the resulting patient factor increases by 10%. That, of course, means that the total treatment time will increase by 10%. So if we accept this for this patient, there we go. So now if we put in a protocol, let's say we, excuse me, put in a protocol for epicondylitis, go to stage 1, click on accept. You can see here that that total treatment time is actually 27 minutes and 30 seconds. That extra 30 seconds comes from the fact that the patient factor was selected with an extra 10% of treatment. Okay, so the normal treatment time would have been 27 minutes. Approximately 10% increase is 27 seconds or 30 seconds rounded off, and that's where you would see that. Now, another way to get around that is if you wanted to actually customize the duty cycle not to affect the total treatment time. In short treatment times, really choosing the patient factor is perfectly fine. However, when you get to longer treatment times, say when they're approaching 50 or 60 minutes, it might be more prudent to change the duty cycle. If you actually have to increase the time, you can choose the duty cycle. So let me give you an example. We'll go to our patient. Again, we'll choose our patient here, accept our patient. Let's say we want to put in a protocol for the patient's lower back. So let's back up a bit. Let's put in a new patient. Again, we'll put in any surname. This time, put in John Court. Their number. Hit accept and reject. Okay, so now this patient does not have any patient factors. Okay, However, let's say they have darker skin. Let's say this patient is African Canadian or African American, and they have quite a bit of melanin. If we chose the patient factors when we're inputting this patient, then every treatment time would increase by 20%. Which, if for a longer treatment, that might start to interrupt patient flow in a clinic setting. So what you could do is compensate by increasing the duty cycle. So for example, let's say we want to prescribe a treatment for the hip joint. So we go to trunk, hip joint, and stage 1. Okay. Now, if we were to accept this protocol, okay, you can see that the total treatment time is 64 minutes, which is just over an hour and relatively long. Now, because the patient is African Canadian, darker skin, technically, if we put in that patient factor, we would have had approximately an extra 12 minutes, so approaching almost 76 minutes of time, so a lot more time. We can avoid that by customizing the protocol instead. So if we go back, let's say, and prescribe the treatment to the trunk and the hip joint, stage 1, instead of clicking on accepting, I want to customize the hip protocol to reflect, instead of increasing time, I want to actually affect the duty cycle, the dosaging. And where that's most important is in the infrared portion of the protocol. So you can see here that the duty cycle is set to 70%. We can change or customize that duty cycle. Let's say we change that to 90% for this patient. Remember that the frequency does not affect the dosage, so we don't really need to do anything with that. And then we can go to the next infrared and then change again the duty cycle to 90, and then to the fourth placement and again change the duty cycle to 90. So what we've done here is we've increased the dosage by 20%. You could have done it by 10%. Anywhere around 10 or 20% mark for darker skin is acceptable. And then you click on accept. Recall that if you want to save this protocol for future use, you could. So for example, you usually save it by the specific anatomical region first. There we go. And then you'll want to save it with a specific description. So in this case, we'll say African Canadian. So someone's aware of that. Protocol stage 1, we add to treatment list. So now we've saved that protocol for future patients that are darker skinned instead of having to customize that again. So we accept that protocol. So now when we go and look at this protocol under view prescription, you'll see that instead of having 70% duty cycle, it actually is increased to 90% to compensate for the darker skin, as opposed to clicking on the patient factor and increasing by the 20%, which would then increase the time. So we're getting more dosage in the patient over the same amount of time, and therefore it doesn't really disrupt the patient flow in the clinical setting. So that's one specific case where you might actually do that. Now, some other scenarios for customizing protocols. Let's say the patients come in and they have a frozen shoulder. So in this scenario, typically we recommend also treating the axillary or armpit region of that patient. So you're going to have to customize the protocol to add 2 extra steps or 1 extra placement in the axillary region. To do that, you would click on prescribe treatment. You would go to upper quadrant. You would go to shoulder joint, stage 1. And if instead of accepting the protocol, you would click on customize. And then you're going to proceed to change this protocol. The first thing you need to do is go to the number of steps in the treatment. Recall that the standard number of steps is 7 to reflect anterior placement of dual red and infrared, a lateral placement for dual and infrared, and a posterior placement for dual and infrared. So first you need to change the 7 to a 9 to reflect these 2 extra steps for the axillary region. Then you need to start to look at each step and make sure that each step reflects the head type and the appropriate either continuous or modulation factors. So the first step is going to be the anterior placement of red. The second step will be the infrared at 1050%. Then the third step is going to be the red for the lateral placement at 6 minutes, continuous wave, then infrared back to 1050%. Then the fifth representing the posterior placement of red and then infrared. And then the seventh step, instead of being the laser probe, will be the axillary placement. So we need to change it to the red array. Okay. Then we need to make sure that the parameters are correct, the 6 minutes and 100% power. And then the eighth step will be the dual infrared. Okay. And recall that it's modulated square wave. Recall the same, we need to put in the same frequency and the same duty cycle, percent power. Well, it should be 1050. Sorry, that should be 1050. Okay. And then the ninth step is going to be your laser probe, which has already been preset. Okay, so once again, what I've done here, if you go back all the way to the beginning, I have now added 2 extra steps. So the first step is anterior placement, dual red, then infrared. Then the lateral placement, dual red, then infrared. Then the posterior placement, dual red, then infrared. Then the axillary placement, dual red, infrared, and then laser probe. So we've set up a customized protocol specifically for a frozen shoulder by adding extra placements. We then go on to hit accept. And if we want to keep this protocol for future patients as well as a current patient, you can put in the shoulder region, the pathology, which in this case is frozen shoulder, and the stage 1, and then add to treatment list. And that way now you have it listed under the dotted line for future reference for frozen shoulder. So let's go on to another example for a customized case. Let's say we want to go to a region and treat it in a very isolated area. So let's go to an example of Osgood Schlatters, or inflammation at the insertion of the patellar tendon at the tibiotubercle. So what we want to do here is specifically go to the prescribed treatment. We want to go to the lower quadrant. We want to go to the knee joint, stage 1. Now, the standard protocol has the treatment being medial, lateral, and posterior for, say, an arthritic knee joint. However, what we want to do is just have one placement overlying the tibiotubercle, and then another step for the laser probe. So we customize this, change the number of steps from 7 to 3 to reflect that, and then we make sure each step is correct. So we're at step 1, the dual 180 continuous wave for 6 minutes. Step 2 will be the dual 180. It's modulated at 50-50 for 6 minutes. And the third step will reflect the laser probe. So we put in the laser probe. Time frame, you might want to reduce the amount of time for a smaller area, so perhaps 3 or 4 minutes would be adequate. And the percent power, recall typically for an initial protocol is say 40%. And then you click on accept. Again, if you want to save the protocol for future reference, both for this patient and other patients, you can put in the information. However, if you just want to save it for this specific patient, then you click do not add to the list and then click on accept. And now that protocol, customized protocol, is there for your patient. So once again, the basic premise for customizing protocols is that you can change the number of placements, increasing or decreasing those number of placements, or changing other factors like duty cycle or time. A final example I want to give would be an example where, let's say we wanted to treat a hamstring injury. And the standard protocol for that is under thigh and leg muscle injuries. You would go to stage 1. Okay. And then from stage 1, the standard number of placements is actually just 1 placement over the injured muscle. Let's say that torn hamstring has several areas that you need to treat. Let's say 3 areas to cover the entire portion of the injured hamstring. So you need to customize that protocol and add extra steps. So you could go on to customize, change the 3, which reflects just 1 placement. We need to add an extra 2 placements. So that means 4 steps in total. So that 3 would go to 7. And then we would add the number of steps. So we go for red for the first step, the infrared 50-60. And then the second step would be back to the red. Okay. And we have to change the parameters accordingly and change the time. And then the 4th step is again going to be the dual infrared. We're going to modulate it, change the appropriate time, the percent power, and the frequency you recall is 50-60. Okay, so 50-60. There we go. And then we're going to go to the next step and change the appropriate array. It's continuous, 10 minutes, 100%. And then the 6th step is going to be a last infrared array. It's modulated. Recall that's 50-60. The total treatment time is 12 minutes for that at 100%. And the 7th step will be the laser probe, continuous wave. And for a large area, maybe we need 10 minutes of treatment time, start off at about 40%. And then that is our standardized protocol. We accept that. Do not add to the list in this case. Okay, now we have this treatment protocol. If we want to view the prescription, we can see now we have 7 steps instead of the 3. And we have 1 placement here, 2 placements here, 3 placements here, and then the final step being the infrared probe. So again, this should give you a basic understanding of how to customize and why to customize the protocols. And if you have any further questions, please don't hesitate to contact us here at Meditech. Thank you.